Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled, Randomized Controlled Trial of Durotomy as an Adjunct to Routine Decompressive Surgery for Dogs with Severe Acute Spinal Cord Injury. Introduction. Functional recovery after severe spinal cord injury (SCI) remains a challenge despite substantial research. Current therapies are limited to decompressive surgery (DS) and physical therapy, but acute SCI causes tissue perfusion impairment, molecular cascade activation, and progressive tissue loss. Pharmaceuticals are difficult to deliver effectively to the lesion, and epidural delivery and pressure reduction are potential solutions. Recently, durotomy has been investigated again, with experiments showing improved gray matter survival and locomotor outcome in animals and reduced ISP associated with duroplasty in humans with SCI. Companion dogs with acute SCI resulting from disc herniation frequently lose motor and sensory function to the hindquarters. Durotomy is hypothesized to increase recovery rates, but past clinical veterinary studies are subject to bias, and the relevance of this canine model to human patients is unclear. This study compares the proportion of dogs recovering after traditional DS with that of dogs undergoing the addition of durotomy. SCI remains challenging to treat with limited therapies available. Tissue perfusion impairment, molecular cascade activation, and progressive tissue loss occur. Delivery of pharmaceuticals is problematic, and epidural delivery and pressure reduction have been suggested as solutions. Durotomy has been investigated again, with improved outcomes in animals. Duroplasty-induced reductions in ISP have also been demonstrated in humans with SCI. Loss of motor and sensory function in the hindquarters commonly follows acute disc herniation in companion dogs. Recovery after conventional therapies for such cases has been low. Durotomy has been investigated as a solution in previous clinical veterinary studies, although these are subject to bias. This veterinary randomized controlled trial compares the proportion of dogs recovering from traditional DS with that of dogs that underwent additional durotomy. Methods. This study conducted a randomized controlled trial approved by the Institutional Animal Care and Use Committee to compare traditional surgery with traditional surgery plus durotomy in the treatment of severe spinal cord injury (SCI) caused by acute intervertebral disc herniation in dogs. This trial was designed with many pragmatic aspects to enhance the generalizability of the results. The choice of perioperative medications and the length of hemilaminectomy were at the discretion of the attending surgeon. An estimate of benefit associated with durotomy for sample size calculations was based on a recent observational study. The study population comprised dogs with severe acute thoracolumbar SCI caused by disc herniation exhibiting no visible conscious perception of severe noxious stimuli, paraplegia, and incontinence. Inclusion was dependent on magnetic resonance imaging or computed tomography localization of the herniated disc to within the T9, L3 region of the spinal cord. Dogs with severe concomitant disease, prior surgical decompression for a thoracolumbar disc herniation, diabetes mellitus, or hyperadrenocorticism were excluded. Control dogs were treated with routine cross-sectional imaging, followed by a dorsal lateral hemilaminectomy of variable length to remove the herniated material from the epidural space. The trial intervention was a 4-vertebral length durotomy after removal of herniated disc material from the epidural space by standard dorsal surgery. The outcome was defined as the ability of a dog to take 10 consecutive steps without falling within 6 months of their surgical intervention. Recovery of ambulation usually coincided with the recovery of urinary and fecal continence. Dogs that experienced progressive myelomalacia extending the region of spinal cord necrosis within 10 days of the inciting injury were recorded for dogs in this study. This study aimed to recruit 360 cases in total, randomized 1 between traditional surgery and 4-vertebral length durotomy. Deviations from protocol were recorded, but dogs were analyzed according to the treatment they actually received. Data were collected onto specifically designed case report forms, detailing demographics, duration of clinical signs, medications, and intervals between onset of symptoms and presentation to the surgical clinic. Logistic regression was used to calculate the odds ratio of recovery in the two groups, to determine the effectiveness of the durotomy, assuming p. 0.05 is significant. This study also included exploratory analysis of recovery of ambulation and interaction between durotomy and time interval from presentation to the surgical clinic and completion of surgery. Study population. Dogs were examined by general practitioners and then referred to specialist neurosurgical clinics for diagnosis and treatment, incurring a delay of many hours before surgery. Dogs at contributing centers were randomized, independently of other centers. In veterinary medicine, acute disc herniation in dogs predominantly occurs in the thoracolumbar junction producing upper motor neuron deficits. However, spinal shock is observed in some individuals for a short period of time. Dogs have 13 thoracic and 7 lumbar vertebrae, and the spinal cord terminates at around L6 vertebra. The pelvic limbs, bladder, and anus are innervated from lumbar segments L4, S3. Post-operative care consists of standard nursing for the surgical site, bladder, bowel, and skin plus pain control using intravenous opioids for 48 hours, followed by analgesic medications such as non-steroidal anti-inflammatory drugs, acetaminophen, amantadine, or codeine. Outcome. Most dogs also recover urinary and fecal continence after recovery of ambulation, but this was not specifically recorded in this trial. The recovery of pain perception in the pelvic limbs was also not recorded because of owner interpretation difficulties or the need for dogs to be returned to clinics for veterinary evaluation. Sample size calculation. This study aimed to collect 360 cases in total, randomized 1 between traditional surgery and 4-vertebral length durotomy. The weight of evidence favors early surgery after SCI, but there is still some controversy around timing in both humans and dogs. The O'Brien-Fleming stopping rule was used because of its conservative nature. Statistical analysis. This study used Stata 18 for all summary statistics, sample size calculation, and data analysis. The study results show that dogs undergoing the trial intervention plus traditional surgery generally had a better rate of recovery with no identifiable detrimental effects. Results. This study enrolled 141 dogs, including 52 dachshunds, who underwent surgery for acute disc herniation. Of these, 128 were included in the analysis. With balanced demographics and preoperative variables between the durotomy and traditional surgery groups, 65 dogs, 51%, recovered ambulation, while 63 did not. Recovery rates were 45% for the durotomy group and 56% for the traditional group, both within the previously reported ranges. Logistic regression revealed an unadjusted odds ratio for recovery of 0.643 for durotomy versus traditional surgery alone, indicating no significant advantage for either surgery. Due to recruitment slowdowns during the SARS-CoV-2 pandemic, an interim analysis was performed after 1/3 of the projected sample was reached. The raw data suggested slightly worse outcomes for dogs undergoing durotomy, leading to an analysis of futility. The Z-score for unadjusted adjusted logistic regression was 1.24, indicating a reduced likelihood of recovery for the durotomy group, but still below the z-score futility bound of 0.025, resulting in the study's termination. An exploratory analysis suggested a detrimental effect of delay in completing surgery after presentation to the clinic, but the timing of surgery did not affect the relative efficacy of durotomy versus traditional decompression. 10 dogs, 8%, developed progressive myelomalacia and were euthanized, 4 in the durotomy group and 6 in the traditional group. Discussion. The proportion of dogs who recovered in this study, 51%, is slightly lower than the typical proportion. During the first 24 hours after SCI in dogs, the average blood pressure is only restored to 25% of its original pressure, which may not be enough to restore blood flow. Although durotomy has been shown to improve functional outcome in moderately contusive injuries, there is no detectable effect in severe SCI cases. This is because the compromise in blood flow due to SCI is not only due to raised intraparenchymal pressure, but also a result of many biochemical processes that compromise both blood vessel integrity and intraluminal cross-sectional area. Unclosed durotomy in dogs is the norm, and while late complications have occasionally been noted, there is no evidence to suggest a systematic detrimental effect on functional outcome after SCI in dogs. However, it should be noted that the contusive compressive lesion resulting from acute disc herniation in dogs differs from Cs caused by external trauma in humans, primarily due to the association with systemic shock and multisystem injury. This study suggests that time is spine, that the delay in decompression surgery may be associated with worse outcomes. It has also been suggested that durotomy may reduce the likelihood of development of progressive myelomalacia in dogs after severe disc-associated SCI. However, more research is needed to confirm these findings. Many dogs that were eligible for this comparative study were not enrolled. The reason for this was largely because owners declined or clinicians forgot to mention the study to the owners. Although this is not optimal, their non-inclusion was not systematic and is unlikely to affect the central conclusion of the study. While it would have been helpful to also record recovery of pain perception in the pelvic limbs plus recovery of fecal and urinary continence, it was not feasible to do so. The study focused on ambulation because it can be unequivocally assessed without in-person examination. The study concludes that durotomy is not beneficial in improving outcomes after severe acute thoracolumbar SCI in dogs. If the study's prediction that duroplasty will be similarly ineffective in the current human trial in cervical SCI is correct, it will provide strong evidence to support the notion that SCI in companion dogs has predictive validity as a model for testing other therapies before embarking on expensive human clinical trials.